Thank you everyone for joining us. Welcome to Who's Who in Your Learner's Ecosystem. We are so happy to have you here. We are celebrating Learning Disability Awareness Month, Dyslexia Awareness Month, and ADHD Awareness Month, Dyspraxia Awareness Month. So we are excited that you're all here together as we explore who's who in your learner's village and how they can be a support to you and your learner as a whole. We're going to go ahead and start with introductions. I am Jess Corinne, Head of Educational Services here at Learnfully. I started my career as a classroom teacher and quickly realized that I didn't feel equipped to serve each and every learner. So I joined forces with Linda Mood Bell to refine the art of multisensory evidence-based implementation. I spent about 10 years really refining that art and learning the ins and outs of implementation on both a small and large scale. And then I started my private practice where I spread my wings and learned even more methodologies such as Orton-Gillingham, Wilson Reading System, social thinking, step up to writing. It really gave me more of a repertoire to pull from when I felt my learner needed something different. Of course, implementing each program with fidelity. So that's what brought me to Learnfully. I am so happy to be here. I oversee our instructional quality, our educational specialist network, and I collaborate with fellow professionals, a few of whom we have here today. So I'd love to pass the mic to Dr. Jerkowitz, who is going to introduce herself first.
So I am Dr. Ilana Jerkowitz. I am a licensed clinical psychologist in private practice, and I have a specialty in working with children and adolescents, but more specifically in psychodiagnostic assessments. So really helping to assess kids, to identify their learning profile, identify their cognitive profile, and then make hopefully some rockstar recommendations for educators and schools to use and to implement in the classroom.
Fantastic. Thank you so much for being here. All right, Nicole, without further ado.
Hi, I'm Nicole Butler. I'm a speech language pathologist. I'm the founder of Speech Within Reach and have 20 years experience. I work with children and adults and have a broad range of areas that I cover. And yeah, I'm excited to be here.
Yay! We're excited to have you. Thank you for being here. Okay, Rachel, you're up.
Hi, I'm Rachel Leonard. I'm an education specialist currently working with Learnfully, but I've been in the field of special education for over 20 years, specializing in Orton-Gillingham and SMARTS executive function training. And just am really glad to be a part of this panel today.
Great. Thank you for being here as well. All right, so today's agenda, before we dive into the main event, I'm going to give you a brief overview into Learnfully's mission, and then we're going to talk about the ecosystem at a glance. So I want to be able to provide you a little bit of information about specialists who you might see in your learner's team, and then we'll open up the floor for discussion. We have some targeted questions for each of our panelists. The goal, of course, being to heighten cognizance on how you can maximize your team to support your learner reach their potential. And then at the end, if we have time for questions, we'll open it up for a discussion and reflection. Feel free to drop your questions in the chat. And if we're unable to get to those in the interest of time, we will most certainly reach back out to you and make sure you have your questions answered. All right, so Learnfully. Learnfully is a personalized platform comprised of a highly curated network of educational specialists from all over the country. They have a multiplicity of credentialing and certification in many multisensory evidence-based programs and the personality to match. So they're able to maintain engagement and maximize the time that they spend with your learners, really making sure that not only does the learner realize their potential, but reach their potential in an expedited fashion. We tailor and differentiate our recommendations in order to meet each and every individual learner's needs. And sometimes that involves referring out to our professional network to ensure that they have all of the information and services they need to treat the whole child. We're also really big fans of proactive communication. We pride ourselves on making sure that everyone from the learner out has the communication they need to serve each learner. And so we constantly are in communication with both caregivers and the professional network tied to each learner to ensure that they see the progress firsthand and that we're able to iterate and make new recommendations as we see fit, so we can ensure that we're still meeting the learner's needs no matter where they are in their trajectory. All right, so the ecosystem at a glance. I mean, this is, to be honest, a short list. Like, it was really tricky for me to comprise a concise, brief list of everyone who could possibly be in an ecosystem for each individual learner. But this is kind of the broad stroke, if you will. Educational specialists and educational therapists are very, very closely aligned. The difference between the two is that educational therapists tend to have certification specifically in therapeutic modalities. Educational specialists can still use the same curriculum that an educational therapist uses, but an educational therapist sometimes has a little different training, if you will, on how to use those therapeutic models. Learning and reading specialists, they tend to be internal to a school community. They can be external as well. Some are in private practice, but more often than not, you'll see these in a school community where they'll serve each learner, whether it be in a private or public school, and they'll provide remediation, which is typically a multisensory evidence-based program that is implemented traditionally one-on-one or in a very small group to ensure that they're meeting milestones and tracking progress in reading, writing, language processing, and math skills. Marriage and family therapists, counselors, mentors, those are ones who are directly connected to the learner and the family unit to provide the therapeutic aspect to ensure that they're treating the whole child. They don't use instructional models or programming per se, but they do provide different formats of therapy, such as CBT and PCIT and so forth. So they're usually working one-on-one with the learner, but they'll also treat the family as a whole from a therapy standpoint. Psychologist, psychiatrist, we'll have Alana talk about what she is able to do through her assessment process and how she's able to find the ecosystem for each of her learners that come through her doors. And then, of course, Nicole will talk us through what being a speech and language pathologist entails. Our occupational therapists too, they're similar. I'd say they're closely aligned, but they don't work on the same targeted skills. So we'll speak a bit to that. Behaviorists train behaviors, right? They help learners feel equipped to manage their behaviors through different modalities, such as applied behavioral analysis. Sometimes they'll work directly with remediation specialists, psychologists, the team as a whole, to make sure that they're utilizing consistent strategies across all environments. And then the last, although I'm sure I could go on, is the assistive technology specialist. Some learners are recommended to receive AT support or assistive technology support. And so a specialist is one who's able to provide recommendations to the team in order for a learner to maximize the layers of support they have through technological means. So they might recommend something like voice typing. They might recommend a scribe or something along those lines, really advancing technology to maximize the learner's ability to reach their potential. Okay, that was a lot. Let's dive into the questions at hand, though. So let's start with Alana, if you don't mind. I would love if you could just talk us through a little bit about how a psychologist supports learners as part of the ecosystem.
Absolutely. So psychologists can approach students in a number of different ways, one being through the actual assessment process to identify a student's learning profile, and the other could be through the social emotional treatment process. So after we really understand what the child's needs are, a psychologist can help that student navigate the system, help them really understand their emotional process. So, you know, a psychologist is a mental health professional that focuses on the social emotional needs of the child, but also could focus on the academic needs of the child as well. Mm-hmm. And so they support students therapeutically, therapeutically either through treatment or through assessment. And with the assessment process, you identify a student's strengths and weaknesses. Nobody has perfection across all areas. Everybody has differences. You know, some people have strengths in one areas and areas in need of a little more growth. And so a psychologist helps to really identify that by going through that assessment process, which I know we'll talk a little bit about later. And then from there to facilitate and to make some, you know, specific recommendations to be used in the school. And then continues to work with parents, to work with the students, to work with educators, to work with speech and language pathologists, other professionals, to support the students through their learning profile and through their learning experience, and help them actually implement these strategies. So to really put the information that we gather into play in the real world, both in and out of the classroom.
Fantastic. I so appreciate that you gave us a glance into how you continue the support beyond the assessment. And I'm sure you'll get into that a little bit more too, but I think it's so important because you don't want to just assess and then set them free, right? You're really good about nurturing them through that process. So thanks for clarifying what you do to support learners. I'd love to hear from Nicole as well. What is a speech therapist? I think this is commonly misunderstood, to be honest, if I could put my hat on as not a teacher mama. But speech therapist can be confusing, I think, to our audience. So can you please clarify what a speech therapist even is?
Yeah, speech therapists are also speech language pathologists. I get that question a lot. Are you
Yes.
also? So the two are interchangeable. And so we're licensed, nationally certified, and require a master's degree. In some states, they do allow speech language pathology assistants. But so we evaluate, we diagnose, and we treat disorders and delays that are associated with a full range of human communication and comprehension areas, you know, including speech, language, social communication, cognitive communication. And it's such a broad range. We even get into swallowing, which is more in the hospital setting.
Yeah, I saw that when I was doing my research. I'm like, I don't think I've ever asked that before when I met with speech therapists.
Yeah. So we cover the gamut, and so I think it's good to have, when you're choosing your speech therapist, to choose someone who specializes in the area that you have a concern with, or your child has a concern.
Because it's such a broad range.
Right, exactly. And
that's a great
depends
point.
and depends on what area they're familiar with working in. If it's private practice, if it's schools, if it's hospitals, there's such a gamut. So I think that is important to kind of do your research and ask them if they know or are familiar or have expertise in the area that you are seeking out.
That is a great point. I might circle back with Alana on that one. So don't let me forget. Good point. Thank you for that, Nicole.
You're welcome.
All right. So Rachel, what's the difference? I also think this can be quite confusing to our caregivers. There's learning specialists, but then there's also executive functioning coaches. So what's the difference between the two? Are they intertwined? Can you help us shed light on that?
Great question. They could definitely be intertwined, but a learning specialist mostly, works with your child in their school to determine best strategies to support their specific learning needs, which we know can range. They provide specialized support and strategies like, multisensory approach to reading, a systematic writing intervention. And sometimes that could be to individuals or groups of learners that are struggling academically. And then an executive functioning coach, we're definitely focusing on the executive function and academic needs. We're building and supporting the executive functions, such as planning, goal setting, flexibility, working memory. And then we monitor progress and adjust as needed. The coach partners with the learner and families to kind of guide the learner through the process. And our ultimate goal is independence with those.
And we'll get into the executive functioning modalities in a moment, do a deeper dive. So thank you for that. Okay, so I'm curious what the assessment process entails. I think some caregivers are, rightfully so, nervous about embarking on this journey through psychological assessments for whatever reason. So I'd love if we could provide some insight into what does the process look like? Is it really as scary as it may seem?
Absolutely. So it should never be scary. Actually, I think a psychological assessment is helpful for everybody. Every student going in to school could benefit from the process. Now, that's not to say that every student needs it, but it can benefit everybody, and it does give us useful information. So the assessment process, a comprehensive assessment, really looks at all areas of functioning. So it's looking at a full range of cognitive domains, including verbal and nonverbal processing, auditory processing, visual processing, memory, which is comprised of a number of different areas, processing speed, looking at executive functioning, looking at attention, all these areas, looking at speech and language as well to a certain extent in terms of expressive and receptive language. And comprehensive assessments are also looking at academic skills. So where is this child performing in the basic areas of reading, writing, and math? Because that's the foundation for every other class that they would essentially be taking. And then also looking at the emotional functioning of the student. So very often when students have been struggling, they feel it and they see it and they know what's going on, but may not fully understand what the process is and why they may be struggling. And so that could bring up and lead to some, difficult emotions. And so it's also understanding the full picture of how all of that interacts. So that's the comprehensive piece. A psychoeducational piece, a psychoeducational assessment, looks more specifically at academic functioning. So what are the basic cognitive areas? And we look very basically at cognitive functioning to understand a student's potential, where they should be performing, where we expect them to perform, and then how are they performing in those academic areas? So are they at expected levels? Are they maybe underperforming? Are they excelling? And so we certainly want to nurture that piece as well. And so really understanding functioning just in terms of the academic areas without looking in as much depth at, attention and potentially executive functioning and language and memory, but really looking at that academic piece.
And may I ask, not to interrupt, I ask, when do you recommend one go through a psychoeducational assessment versus a comprehensive? Is there something that kind of makes the difference there?
So a psychoeducational assessment will sometimes give you just enough information to identify a learning difficulty or a learning difference that then you could target interventions.
Okay.
And so if it's really more of a specific issue that you're seeing in reading, writing, or math, and you just want to identify maybe where that difficulty is or how weak that area may be for that student, then a psychoeducational assessment may be enough information. It won't ever answer all of our questions. So if there's ever a bigger question of, I really don't know what's going on, then a comprehensive assessment is better suited because it does look at all of the different areas and it can answer then that question. If it's more of, this student's really struggling in just reading, and so I want to know, what is it about reading? And it's more specialized in terms of the question. So that would be part of that decision-making process. But the psychoeducational assessment could give you just enough information, again, for those specialists to come in and target the interventions. But it won't give you a full, complete picture of their cognitive profile.
Okay.
And
then
in
how
general,
often, go ahead.
Yeah, go ahead.
I have so many questions. How often do you recommend one is reassessed? Like, it's not just a one and done, right? We have to look at the trajectory. How often do you reassess?
Yeah. So it's recommended to reassess every 3 to 4 years. Now, there are certain difficulties that will persist, and we just learn to cope with them and learn to work with them in our everyday lives. But a reassessment every 3 to 4 years can identify changes that have occurred and can also identify what treatments and interventions have worked and maybe those that haven't worked. And then you could reevaluate things. So usually students are identified early on, but that's not always the case. Sometimes it doesn't occur until middle school or high school that, students are actually identified as struggling in one or more areas. And so then the reassessment process doesn't occur as often. But if a student is identified and assessed initially in maybe second grade, they will likely be assessed at least one additional time, possibly even 2 times before going off to like higher education at college. And typically when students are working with accommodations, they will need updated assessments moving on to college as well, because those universities want to see where that student is now and what recommendations are still appropriate. So there are some recommendations that we make for second graders that won't be as appropriate when that student gets older. And so it also allows us to just keep working with those recommendations and those interventions.
Great. And as you mentioned, you continue to support and oversee kind of the learner's journey, if you will, thereafter. So I think that's such a huge asset. The value add is to continue to oversee and check in and make sure that within that 3-year frame before they reassess that they're still following the recommendations and their needs are being met.
Exactly. Yeah. So, I mean, the process starts with, the parent interview and gathering history information, and then obviously test administration. But one of the most important pieces is really the feedback session of just understanding what do these results mean, and then what do we do with the information. So talking about those recommendations, talking with not only the parents, talking with the child so they understand and feel empowered by their strengths. And then also speaking with the schools and other, learning professionals who are working with the student to help implement all of those recommendations, and then to keep that as a work in progress. Because we have to try things out. Sometimes it's a little bit of an experiment in terms of what will work, and you have to tweak it along the way. So it's important to keep that follow-up. I always describe the assessment, the report that parents get at the end, as a living document. We're always wanting to go back to it and always wanting to reference it. It's not just, like you said, a one and done where you just get your report and then you move on. But you want to keep reminding yourself of what is the student's profile? How do they learn? What are their strengths? And how can we actually use that information?
Love it. And I so appreciate that you target the strengths that make the learner who they are, right? You have to look at it from both sides and bolster the strengths and treat the areas of need. So thank you for that comprehensive analysis of comprehensive psych assessments. I appreciate it. Okay, Nicole, so I'm curious, that's where we kind of start the journey, if you will, but then if we're recommended to receive some speech therapy, what does that look like? What does speech therapy really entail?
Yeah, after 20 years, I've realized that a big piece of our job is just capturing our clients' attention and interest, because as we know, if you're not attentive or not interested, you're not going to learn and then remember. So it's actually probably the largest piece. But the types of clients that speech therapists are known for, that we work for, are, I'll speak of that, and then the ones we aren't as known for. But we're probably most known for stuttering and articulation delays, such as a lisp with the S sound. The S and the R are the trickiest, hardest sounds in the English
language. It's the lifters. Yes.
I know. Stubborn, and I feel bad for anyone trying to learn the language, let alone like us that are already here and little and 2 years old trying to do it. So there's two different types of lists. There's the lateralized, which is on the side, so the air is coming from the side, or the interdentalized, which the tongue is sticking out straight when you're doing the S sound. And then the R, which is, remember Elmer Fudd, when he would say, Twiggy Wabbit, and he would use his R's, he would replace it with a W. So those are probably our hardest sounds. But we're also known for a lot of other things, like we kind of talked about. Some of the areas that we specialize at Speech Within Reach is autism, auditory processing delays. We work with cerebral palsy, deaf and hearing impaired. So I specialize, I'm fluent in sign language. And so individuals that are getting a cochlear implant or completely deaf or just hearing impaired. And then Down syndrome, apraxia, which is a neurological condition, late talkers who are, 2 or 3 and they haven't said more than a word or two, cognitive and memory delays, including comprehension delays. And we address building appropriate social skills, which is something I really enjoy doing. We have a whole variety.
I think that's amazing and phenomenal that you have such a wide breadth of experience that you can treat each and every learner for what they need. And I think it's commonly misunderstood that you do treat social skills. I mean, that's something that I am constantly pounding the pavement to make sure that our audience knows, because you specialize in so many areas that you forget that social skills is one of those areas.
Right. And I think a lot of, kids that are struggling in certain areas, that piece, they forget that, that could be struggling. And we like to work with our psychologists, like psychotherapists, as well, because, they need that support sometimes, because there's an emotional component attached to it. Same thing with stuttering. There's an emotional component often,
Yeah,
here I am
100%.
stuttering just talking about it.
No, it's 100%. I totally agree with you. And
Yeah.
so let's say that Dr. Jerkowitz recommended speech therapy and she would specify, what the need was. How often, how frequent? I know it's not one size fits all, just like for educational therapy, but I'm curious to what the average amount of time you may see a learner each week would be and kind of what the lifespan of your treatment would look like.
Yeah, that's a great question. It does really vary, but
Yeah.
traditionally, and it depends on the attention skills, if it would be a half session, which would be 25 minutes, or a full session of 50 minutes.
Okay.
So traditionally 2 times a week is
Mhm.
kind of the general. If we're working on a basic, one S sound, then you probably only need 1 time a week. But
Okay.
if, we're having a lot of other components or a larger, things to work on, then we're going to need 3 times a week. I think
Yeah.
over 3 times a week, it's a lot. And I feel like kiddos today have so much already that is in their lives. And I think that a big piece that, is important is to have time with family and like that friend time, depending on the situation. So I try to be mindful of that too. So
Right.
not
It's a
overdo the
balancing.
homework. Yeah.
Yeah,
Exactly.
it's a balancing act. I mean, at Lindsay Mood Bell, we were very intensive in our implementation. And so we balance it at Learnfully as well as like, what are the priorities? How do we treat the whole child and make sure that they have those other priorities met? So that's
Exactly.
very helpful. Thank you.
Yes,
I
you're
appreciate
welcome.
your efforts. Okay, Rachel. So what does executive functioning coaching entail? And also kind of what does the journey look like as a whole?
All right, great question. Yeah. Well, our first step is to assess and just kind of analyze like what areas within executive functioning that the child might struggle with. And thank you. Yes, they're beautiful. Self-monitoring, working memory, all of those important executive function pieces. Like, is your child unorganized? Are they unable to properly plan? Do they find it difficult to manage their time appropriately? And then we use that information to strengthen the weaknesses with, an evidence-based approach. We set goals between the coach, the learner, and the family. It's really important at that team approach. And then the executive function coach, they teach the skill often directly, models it, and then tracks the strategies that are being implemented to accomplish each goal. We also fine tune, is this working? Is it not working? What can we do that works for that learner? Because each learner is so different. And then, it's direct. It definitely focuses on developing processes and strategies that work for that learner to develop those executive function skills. It's not always solely focused on academics. That's another key component too. But it definitely always leads to benefiting
Yes.
our academics. So
yeah, that's very helpful. I think, this is definitely a potential pain point for some caregivers and educators. I would imagine as executive functioning is kind of like the preface to reaching their potential in many ways. And so as that precursor in the prefrontal cortex, the inability to streamline to the other areas of the brain that are responsible for just life's happenings, right? Academic, social, emotional, and so forth can be really troubling for everyone involved. And to agree with your point, Nicole, it's, you have to make sure they have buy-in, that it's interest-based, that you're incorporating strengths and areas of engagement, and just making sure they feel that they have like some skin in the game. They're accountable to themselves and they see the value. You make it meaningful, because I think executive functioning is something that still needs a lot of education in our community, but especially with each individual learner as we're teaching them how to think metacognitively, how they learn, so they can advocate for how they learn best. But again, it's not just a quick fix. Like, this is a habitual training module that you need to have a little bit each week and mentor, model, test. Just like you said, Rachel, it makes perfect sense. So depending on the time frame, right? Like it doesn't necessarily mean you're going to have a 6-week plan. It has to be based, differentiated. And so that could then venture into a whole school year, let's say a couple times a week. So, and I appreciate that you said that the goals are pinpointed, because some who struggle with executive functioning may not struggle with organization, they struggle with flexible thinking, right? So you really have to pinpoint exactly where the breakdown is occurring and then make a plan accordingly. It's very helpful. Thank you. I obviously get fired up about executive functioning. I love it. Okay, so let's turn it to Dr. Derkowitz. How do caregivers know where to start? So, I mean, I think with the pandemic, one of the positive things that's come out of it is we have seen an uptick in caregivers' awareness of how their learners learn because they observed firsthand through distance learning how they learned. So, how do they know where to go, where to start, and how to initiate potential support?
So I think the key is to take a step back, right, and to wonder. So a lot of times kids were identified in school because teachers were noticing that they were struggling or avoiding certain tasks. And so just like you said, just that happened at home where parents noticed that their children were having a really hard time in one or more subjects, couldn't get work done, or were avoiding it. And the avoidance could look like a number of different things, right? Becoming totally immersed in something separate, or really blatant avoidance where I'm not going to do whatever it is that they needed to do. And so I think caregivers really saw that. So the key is to take a step back and to wonder, why is my child maybe avoiding? Why are they struggling in this area? Why don't they want to do their homework? Why are they procrastinating? Why are they putting things off? And so if those situations come up a lot and they don't seem to be isolated, because we all go through those times where we just don't want to get done what we have to get done, right? That's normal. But if it's happening all the time and a student is really struggling and just doesn't want to do it or is becoming very emotional by the process, homework should not be taking all night. Kids need to be kids. They need to go out, they need to play, they need to use their imagination. They should not be sitting doing homework for hours upon hours. And so if they are becoming really emotional when trying to complete tasks, or it's taking them a long time, then we have to wonder why, right? Is something getting in the way? Is this task, is this skill maybe really difficult for them and it just hasn't been identified and they're internalizing it? Or is something else going on, that's getting in the way? Maybe it's more emotional and the child has a more perfectionistic attitude and that's what's getting in the way. And very often students will have skills exactly where they need to be, but it's their emotional process that prevents them from actually reaching that potential. So we have to wonder, and that's why that emotional piece is really important in the assessment, because it helps shed some light on what may be going on in terms of that, psychological functioning. So that's just that wondering process. I think collecting that information from teachers or others that are working with the student. So asking teachers, how are they doing or what they're noticing, but with the caveat that teachers have a classroom full of children, and on Zoom, they have a screen full of students where they can only see their little heads. So it's impossible for teachers to really be able to pick up on every little nuance that's going on in the classroom. But it's still important to understand what they're observing. So once that starts, then, if there's still some questions and there's still some avoidance, we want to nip that in the bud. We want to empower kids. We don't want them to feel like they can't reach their potential, but just here are ways that they could do it, right? It's like training for anything else. You can't just run a marathon, you have to work at it. And so, we have to teach kids that too, that it's okay to work, it's okay to make mistakes, and these are things that could help them. So that would be kind of where to start.
Love it. No, absolutely respect and love everything you said about the fact that you have to take a step back. Because I think as a parent who has neurodivergent learners at home, we so quickly want to dive in to help and also let anxiety kind of push that point. And so sometimes you just got to take a deep breath and relax and look at the whole picture and then seek support. So thank you for advocating for that, because again, we are an ecosystem. We are here to work together to empower and support and bolster our learners from the ground up. So I thank you for saying that. It makes perfect sense.
Yeah.
Okay, so we're going to do a roundtable. I'm curious to hear from each of you. What is one thing we've discussed quite a bit in this webinar, and I know it has left so much more to discuss as well, right? But at this point, if you could just give us one final thought on what you think caregivers just need to keep in mind, I would so greatly appreciate it. I'm going to start with you, Nicole. What is one thing that you want caregivers to keep in mind?
You're not alone, that there's a lot of support. especially
Perfect.
these gals.
Yeah, we're all in it together. But it's true because it can feel isolating, right? As a parent who has struggling learners, it's really exposing and it's sad at times and it's confusing. And so knowing that we are a village can go a long way.
Yeah, and I think a lot of people will wait because they're not sure, unsure, or don't know who to talk to and not comfortable. So, just trust that you're not alone.
I love that. Thank you. Yeah. All right, Rach, what is one thing you want them to take away? One thing to keep in mind?
I think the big thing is to just ask questions. Ask questions. We are here for you. We welcome them. We want you to feel supported, and nothing is too small.
Yeah, it's kind of like that traditional mindset. If you have that question, many others have that same question. So you might as well take a leap and ask it. That's great. Thank you. Okay, Dr. Jerkowitz, final thoughts.
So I would say, I mean, I agree with everything. I think that the biggest thing is that it's okay to get services, right? I mean, we as professionals, we're here for a reason. We have gone through training, and you've heard, I mean, from Rachel, Nicole, like all the training that they've been through, all the experience that they have. And so use your resources. It doesn't mean that there's anything wrong with your child. It just means that their brain is working differently than maybe we expected. And so really use the resources around you. And we want to empower our kids to love learning. And so when they have that support and they feel like they have that cheer team to root them on, I think they're more likely to be empowered to go through the process. But it's okay. These resources are here for a reason. It's not a bad thing. They're actually really good and really, really useful.
And like you said, they're very empowering too. So, your learner will come out with a stronger baseline skill set, foundation, and framework to stand upon. And I mean, at Learnfully, we're on a mission to normalize learning differences and empower neurodiversity as a whole, because it's so key that learners learn who they are and how they learn, so they can feel that self-advocacy modality as they get older. So I think all of that is extremely important to keep in mind. Well, let us be here to support you. We also have a system we use to ensure that each and every one of our learners who comes on our platform is taken good care of. We start with a caregiver questionnaire. Sometimes that involves an aptitude screening so we can pinpoint where the breakdown is happening. Quite often we have recommendations come in from psychologists like Dr. Jerkowitz. So we use those recommendations and we sprinkle in a screening to ensure that we're meeting the learner's needs all along the way and monitoring their progress. We also want to make sure that each and every one of our learners is matched appropriately based on need, rapport, relationship, connectivity. And so we have a complimentary meet and greet where I feel like I'm a premier matchmaking service, where I make sure that I look at all the needs, I take everything into account, I scan our network of highly specialized educational specialists, and then we look at who would be the best match, not just in terms of certification, but also personality, interests, strengths. And if all goes well, which typically it does, but if it doesn't, we can always find somebody else to support your learner. Then we have a debrief, we have a consultation, we talk about the recommendations and the learning plan. And I would say 99.9% of the time, that consultation debrief does include a reach out for other professionals in that learner's ecosystem to make sure that we're all communicating as consistently as possible to ensure the learner's success. We also offer quite a few programs. We offer one-on-one support. We offer pair support where it's 2 learners with 1 specialist. We offer small groups, which is anywhere from 3 to 5 learners. And we offer classes in each of these channels, if you will. So we have remediation, which is when a learner is not their performance and their potential. There's quite a disparity. We want to bridge that gap. So we'll offer some of those multisensory evidence-based programs that I mentioned earlier. We have enrichment workshops where we work with pairs, groups, classes, and we're looking at a specific targeted skill. So let's say they have a really strong foundation, but they're struggling with expressing themselves in written form. They can't write an essay, but they can write a paragraph type of thing. And so we'll really hone in on that specific skill, sometimes one-on-one, sometimes in a group format. And then, as Rachel mentioned, we have executive functioning coaching, again, in all ways. So one-on-one, group, classes. We even have an executive functioning simulation where we simulate the experience of learners who face executive dysfunction to provide insight to both educators and caregivers alike into the lens of a learner who's struggling in this way. So many layers of support services. We are all here for you. If you have questions, concerns, we're happy to provide any insight possible to ensure that your learner is put on a positive path towards their potential. So please don't hesitate to reach out and contact us. And we can make sure that if you reach out to us, we will link you to our panelists. If you have questions for them, feel free to call, text, follow us on socials, whatever floats your boat, just to make sure we're here to support your family, your learner, and really the ecosystem as a whole. Thank you, everybody, for joining us. We are so grateful for your time. I'm so thankful that we were able to spotlight all of our specialists here today. And again, welcome any questions that arise after the conclusion of this webinar. Thanks, everyone.